Good friends, I'm Dr. S.K. Gupta. Since the time the news has come in the media that a special type of virus called as the HMP virus or the human metapneumonia virus has spread in China and has taken over a large number of children in China, a fear has gripped in the Indian society and the people are scared that a COVID-19 like situation may not recur in India and create a havoc in the society. Dear friends, there is nothing to fear because there are fundamental differences between both the viruses. COVID-19 virus 5 years back was absolutely new virus and we didn't know and we did not know anything about the virus. While the HMP virus is a pretty old virus and it was discovered in 2001, we are fully aware about the genome of this virus. We know that the virus spreads by coughing or sneezing, and when the person coughs or sneezes, the secretions are suspended in the environment in the form of droplets and which are inhaled by the other people. So it is important to maintain a proper distance from the patient to avoid inhaling these droplets. Therefore, it is also very important that people maintain adequate cough hygiene and they should cover their mouth and nose with the elbow or with the hanky while coughing or sneezing. Secondly, in case somebody happens to shake hands with the person suffering from the HMP virus pneumonia, then later on that person touches his eyes or mucous membranes or the nose, then the virus can go into the respiratory tract and cause infection. So it is important that people who are touching the patients with the pneumonia, they wash their hands and maintain the proper health hygiene. Thirdly, in case somebody happens to touch the fomites, that is the objects used by the patient, then even the secretion on these fomites or the objects, they can transfer the virus to the other people and cause infection. So it is always very, very important that we maintain proper hygienic conditions and maintain health hygiene. It is also important that when the COVID-19 virus came into existence in 2019, we did not know how do we diagnose this virus, what are the symptoms of the disease. While we know that HMP virus basically spreads and affects mainly the children, especially the children below 1 year of age, while the COVID-19 was primarily affecting the adults, though it affected some children also, but primarily it was an adult disease. Secondly, the COVID-19 virus had a higher mortality of about 2 to 3% in the beginning, and with the improved diagnostic conditions and other facilities, we were able to bring down the mortality to less than 0.1%. While in cases of HMP virus, the mortality rate in the past spreads have been pretty low. And we are not really very scared about this virus, though we need to be vigilant and cautious that it does not spread. Thirdly, we are already aware about the full genome of the HMP virus, and the vaccine can be made very quickly. In fact, there is a vaccine called as M1653 vaccine made by the Moderna, which has already gone through the phase 1 trials, and the results have been published, and the vaccine has been found to be effective in the phase 1 trial in the adults between 18 to 49 years of age. And in case there need be the phase 2 trials and the phase 3 trials, they can be completed quickly, and the vaccine can be made available on the mass scale to the people to contain the virus spread. Now the question comes whether the cases in China are really too many. In fact, there have been outbreaks of HMP virus in the USA, and about 12 to 15% of the children have been found to be suffering from the HMP virus, and the mortality in these spreads or in these outbreaks has not been very high. While in case of the China, the reports say that about 6% of the children have been found to be suffering from HMP virus among the respiratory illnesses. So there is nothing a cause of concern as of now, and the government is keeping a full watch, and we are having a good experience of containing the COVID-19, and people being fully educated to use masks and have the cough hygiene, are in a position to contain the pandemic in case it occurs, and there is nothing as a cause of concern as of now. Then why is this hue and cry about the cases in China? In fact, this is a routine increase in the virus which basically occurs in the winter months. As here in India also, the cases of the cough and the fever, they increase during the winter months, and same has been there in China. But we are being overcautious and working with the abundance of caution, and we are scared that a COVID-19 like situation may not recur, and so the media is trying to create awareness, and we should all be cautious and trying to restart using the mask and cough hygiene and start washing our hands in case we come across any child or an adult suffering from cough or the flu or the fever. It is going to prevent the spread of other respiratory illnesses also. As of now, there is no cause of concern, and we should not be spreading panic, rather helping each other by educating the masses.